out. And often the things that I will tell parents, so I often say at least a wet diaper every 8 hours. Are they producing tears? Are they at least waking up to have some sort of feed and wanting to eat? They may want to eat less often and more frequently. And I highly, highly, highly recommend suctioning before eating and sleeping, as it will really, really help them. Then as far as respiratory things to look for, I will say that you want to look for things like nasal flaring. So nasal flaring would be this part of their nose going in and out, head bobbing. If they're working really hard to breathe, where they're to the point that they're like this, they are struggling. Another thing called retractions, where they will be pulling in on their chest. There's different levels of retraction, so I would leave that up to a medical professional to determine if that is safe or not. Babies in general do belly breathe, so sometimes this can be a little bit more tricky for parents to differentiate. So I will often say if they're retracting while having nasal flaring and head bobbing, I would be concerned and bring them in for evaluation. So those are the things that I would look for with their breathing. Are they breathing so heavy that they don't want to eat or they can't eat? Would also be concerning. The other thing with RSV is often that it will come with a fever. So if they are to the point where they will not eat or sleep or drink, or they're breathing heavy, give them something to help bring down that fever, see if it helps. They are going to go in waves where they look bad or they look worse because that fever is spiking, and they're not going to want to do those things. Typically RSV will have this sound of like almost like a wheezy sound, where it sounds like they're kind of struggling. Often if you suction them at home, you will be able to clear that sound. Again, having something to suction at home is important when it comes to that, because it will really help improve their symptoms and could keep you from having to go to the ER or an urgent care or being evaluated, and help you manage it at home. The other thing that I will say is that if you are coming in on day one and you are looking bad and they're a younger kid, I will really, really, really encourage you to watch these symptoms, because typically the worst times of a virus are day 3 to 5. So if you are in the beginning stage and you're already concerned, it is a high possibility that they could look worse before they get better. So just knowing that and being aware of that, RSV bronchiolitis is something that can escalate very quickly, and just knowing how to properly look for and treat them is really important. But it is often something that kids do handle really well and can get over, and with the proper tools like the last video, you can help your kids get through it. I really hope this was helpful. If you have any questions, please feel free to leave them in the comments below, and give me a follow if you are liking these videos. Thanks, guys.